Good morning, welcome back for another TB event update in El Paso. My name is Robert Resendiz, R-E-S-E-N-D-E-S. I'm the health director for the city of El Paso. And we have several updates for you. I want to reiterate that this is an ongoing, active investigation. So every time we think we're towards the end, something else happens and it gets a little bit more expanded. It's kind of customary for things like this. So as the numbers move, please be patient with us. It's because the incident is moving as well. I want to thank our parents and with our babies. If you came in, you probably saw a lot of parents still coming in to be tested. They've been very patient. A lot of them are very anxious. We want to do our best to put them at ease, answer as many questions as they have. But they've been great in coming in and making sure their babies are taken care of. We're announcing today that yesterday we had 2 more positive babies. One of them a true positive, if you will, and the other one had been vaccinated with the TB or BCG vaccination, so most likely that's a false positive. But again, even these babies that we call false positive, we're offering treatment for them as well as a just-in-case measure. An important thing that I've probably failed to say in the past is throughout this investigation, we so far have had no active tuberculosis in any of our babies, and that's important, and that's something we really want to keep that way. I think last time we met, we told you that 90% of the babies identified on the list had been contacted. We're doing a little better. We're up to 92% of those have been contacted. Our list shifted a little bit. We had been at, Nick, what was the old number?
853.
We were at 853. We've added 7 more babies, so we're up to 860 babies that we're interested or focusing our attention and having them screened and treated if appropriate. We've been doing for these past, this is week 3 of doing mass screening, seeing over 100 patients a day coming through. This will hopefully be our last week as we've seen most of those babies. That doesn't mean the screening's going to stop, it just means the 100 a day is going to stop. We have 8% of people that we still haven't contacted, and we expect them to be trickling in over time, and as we find them, we'll take care of them, but it won't be this very large-scale effort that we're doing now. We've had some questions about why is this taking so long? In my opinion, this is going pretty quickly. We thought we'd take 6 weeks. It looks like we're going to be substantially completed in 3 weeks. I know some parents were a little upset that their appointments were out 5 or 6 weeks. We call those parents and move them in to earlier dates. So again, we should be substantially complete by Friday of this week. Of those who we haven't reached yet, that's about 8%. We're still looking for them. We're using all our resources to find them. We hope the media can help people see this, know that a friend of theirs maybe had a baby at the hospital. Ask them to call us again. We ask people to call 211 for information and appointments. That the first 50% is easy, the next 20% a little more difficult. That last 5% is always the most difficult in any investigation. At this time, we're transitioning from screening to treatment. We now have 18 babies who are being treated with the medication necessary to prevent tuberculosis. So what that means is we have workers going to their home twice a week, check on the baby, make sure the baby's doing fine, deliver the medication, and make sure that the medication is being properly given to the infant. We want to ensure quality care. You know, early on when people said, you know, why can't you do this fast? We could probably pull this off in a day, but our quality would have been very suspect, very poor. By doing the best we can as quickly as we can, but with high quality, we don't have anybody falling between the cracks. In fact, every baby that's come through, their chart and their records are being reviewed by a secondary nurse just to make sure we're doing the very best that we can. Quality is incredibly important in this investigation. We are still in almost daily communication with the CDC and our Department of State Health Services in Texas. We report to them, again, almost on a daily basis. And we relook at our strategy, make sure that we're doing the right things at the right time for the right babies. And again, this number is getting slower. It hasn't moved as much as it used to, but with an ongoing investigation, that can always change. We have 3 concurrent investigations going. The babies, of course, that's the big one with the 800+ number. We're working with the hospital to still follow up on their employees, the co-workers of our, what we call our index case, our infected patient. And of course, the personal and social contacts of our index case to make sure that those people are being screened and treated if necessary. So with that, I'm going to turn over the microphones to our health authority, our medical director, if you will, Dr. Hector Ocaranza.
Thank you, Mr. Resendes. I'm Dr. Hector Ocaranza, the Health Authority. And we want to just remind the people about the medication that we're offering, especially to those infants that are less than 6 months. Those are the ones that we consider to be most susceptible and most at risk. The treatment is very easy. It's being given twice a week. And the nurses that go to their homes are being trained to identify if any, side effects of the medication. It is a safe medication. It is not common to have babies that have or develop side effects. So we want to stress that to the parents. We understand that those parents are concerned about giving a medication for a long period of time to those babies, but we want to make sure that those babies are going to be fine. And remind them that even though they have been screened and it's been negative, they need to come back at 6 months to re-screen them, do again the TB skin test, and do again the chest x-ray, because now the test is a little bit more reliable when they're older than 6 months. So we want to make sure that the parents understand that the medication is for the safety of the baby, so they don't have the latent TB and develop the disease later on in their lives. I don't know if you want me to, in Spanish, I'm sorry for the Spanish-speaking media that we have. Buenos días, el señor Resendes es el director de nuestro departamento de salud, soy el doctor Héctor Ocaranza. Y de lo que los trajimos aquí, más que nada para decirles que hay 2 casos nuevos. Uno de ellos está relacionado a la vacuna de la BCG y el otro no tiene la vacuna de la BCG y sí lo consideramos más un caso positivo. En estos momentos no tenemos nadie con la enfermedad activa, entonces estamos confiados de que vamos a seguir así. Posiblemente encontraremos alguno que otro positivo, igual que los hemos encontrado hasta ahorita, pero vamos a seguir nuestra estrategia de ofrecerles el tratamiento preventivo y seguir haciendo las pruebas de escrutinio a todos los bebés que tenemos. A los bebés que son menores de 6 meses les seguimos ofreciendo tratamiento preventivo, que más que nada se los ofrecemos para prevenir el desarrollo de la enfermedad activa en un futuro para estos bebés. La preocupación que tienen muchos de los padres en cuanto al tratamiento es de acuerdo a los efectos secundarios de la medicina, pero queremos asegurarles que el tratamiento es algo bien efectivo, es seguro para los bebés y las enfermeras y los trabajadores que tenemos en el Departamento de Salud están entrenados para ir a su casa, detectar, le van a hacer preguntas, más que nada orientadas para identificar ese tipo de efectos secundarios que en algún momento pudieran presentarse. Queremos recalcar que no es común que tengan estos efectos secundarios. A las personas que todavía falta por identificar, sobre todo aquellas que viven en el extranjero, en México, exhortamos a todas esas personas que vengan, nos hablen. Hay un número 1877 que pueden hablar del interior de México, que van a comunicarse con nosotros aquí. Les hacemos esa invitación para que vengan o acudan a su centro de salud en donde vivan. Si viven en Chihuahua, si viven en alguna otra ciudad de México, acudan a su departamento de salud, donde se les va a practicar las pruebas que necesitan.
¿Cuántos niños faltan en México de localizar?
Ya hemos localizado aproximadamente el 91%, el 90%. Nos faltan unos 3, 4 niños, posiblemente.
Pero, ¿podría hablarnos un poquito sobre el riesgo que se corre? O sea, que mucha gente no entiende que la tuberculosis es una enfermedad pues, muy contagiosa, ¿no? Pero muchas veces no lo entienden. O sea, ¿cuál es el riesgo que ustedes ven que no acudan con los médicos para hacerse esto?
Claro que sí, el riesgo que existe para estas personas que están expuestas o que han sido expuestas es de que la bacteria esté en una forma durmiente en el cuerpo y se active en un tiempo, no sabemos, meses, años después, el cual puede crear la infección activa, y ese es el riesgo que tienen, sobre todo gentes que consideramos de alto riesgo, como los bebés, gentes que tienen problemas con la inmunidad. Son las personas que están más en riesgo de tener esa bacteria y que se desarrolle en un futuro. Entonces, por eso les ofrecemos este tratamiento preventivo para evitar de que puedan desarrollar la enfermedad activa.
A veces las familias, por ejemplo, se les conoce una madre ayer, dice que tiene miedo, aunque salió negativo, pero dice, yo no quiero el tratamiento porque le puede afectar a mi bebé. Entonces están como en un dilema.
Claro que sí, y es comprensible ese miedo que tienen como padres si vemos a nuestro bebé chiquito, que no queremos darle medicina por varios meses. Queremos recalcar que esa medicina es una medicina que ha sido usada por muchos, muchos, muchos años. Es una medicina que se ve que es segura. Tenemos que decirle de algunos de los efectos secundarios que tiene porque queremos que los padres estén informados de una fuente fidedigna, que es las personas que están en la clínica de aquí de tuberculosis. Pero más que nada, no para asustarlos, sino para hacerles hincapié de qué es lo que tienen que fijarse estos papás cuando le están dando la medicina. Aparte, una de las cosas que tenemos es de que estas personas que van a ir a administrar la medicina van a su casa y van a estarle preguntando una serie de preguntas que están enfocadas más que nada a identificar este tipo de efectos secundarios. Damos a nuestros bebés Tylenol 2, 3, 4, varias veces cuando los papás piensan que necesitan dar medicina. Esta medicina sí es recomendada, está recomendada por los expertos y por eso creemos que es más el beneficio que les va a conferir el no darla.
Tengo otra pregunta. ¿Ustedes han considerado que pudieran tratarse de niños también, de padres indocumentados, que tengan miedo de acercarse a las autoridades de salud porque que lo vayan a deportar o que pueda pasar algo así? Porque eso ocurre mucho en el Consulado de México, ¿no? Que hay familias indocumentadas que no quieren acercarse por temor a que los denuncien ante la autoridad fronteriza o las autoridades. ¿Ustedes completamente van a reservarse su identidad y todo esto?
Claro que sí, la información que recibimos de esos bebés no la compartimos con otras autoridades de migración, por ejemplo, y lo que estamos interesados es más que nada en el bienestar de esos bebés. Vivan donde vivan, por eso exhortamos a todas esas familias de México que vengan, se acerquen a nosotros, les vamos a ofrecer el mismo tratamiento, las mismas pruebas de escrutinio, y a las personas que viven aquí, que se acerquen, no les van a preguntar el estatus migratorio ni nada de eso. No es nuestra obligación enforzar ese tipo de...
Doctor, de estos 853 posibles casos, ¿qué porcentaje tendrá que regresar porque son menores de 6 meses? ¿Tiene un estimado?
Many or less.
How many they need to come back as far as the 6-month screening?
Thank you. Inglés? Percentage? What's that Inglés?
Yeah, that's fine.
The question was of young babies, the 6 months, how many are coming back? Just as a refresher, we've talked about window treatment, window prophylaxis for the young babies. So the reason they call that window, there's a window of time soon after the baby's born that their immune system is weak. So if we administer the test, they may be positive and the test doesn't come back positive because they're weak, so we treat them anyway. When they turn 6 months old, their immune system is a little bit better. That window of time is over, and we test them again. So we now have 199 of the under 6-month babies who have been scheduled for their window exits test. And again, we're following the CDC guidelines and everything that we do, and we check into the CDC almost every day to make sure that we're sticking to those guidelines. We want the best for the babies, and most people will agree that the CDC has the best protocols.
You say that 92% of the patients have been contacted, right?
Yes, sir.
And then you say that 74% of patients have been scheduled for health department screening. But then you say that 840 have completed their initial screenings. 840 is way more than 74%. And the way I read it is that if they have completed their initial screenings, that means that they must have been scheduled in the past for the screening.
We've had, Nick, maybe you can look that up while I speak to it. He'll do the specific numbers. We've had some people who we've tested that weren't on the list. They went to their physicians, and the physicians have asked them, you know, I think they should have been on the list, I think. So we're working with them. We've also have some patients that get counted 2 or 3 times. If you come in for that initial test, you saw Dr. Okananza get that last time, you've got 48 to 72 hours to get that read. If you miss that, you're gonna start all over again. If you miss it twice, you're on your 3rd time coming through, and we've had some of those. So when we're counting patient visits, sometimes there will be double, triple counting because we're counting the warm bodies that are coming through our clinic.
And the other question is, you mentioned that 7 more babies have been added to the list. Where did these babies come from, and why did it take so long to actually be on the list? And You said that it's something that's fluid, that's ongoing, that more babies could come on the list, but what are we expecting? And are you expecting that even more babies could be added?
It could happen. Do I hope? No. Do I expect? Possibly. But the ones that we add are less and less. So these 7 that we added are actually part of the 15 that we mentioned in our last press conference. When the CDC came last week, they spent a lot of time at the hospital, and there's all kinds of ways of looking at which babies should be tested or not. And they were able to run several computer program mergers, if you will. And of these 15 babies, they were able, through the computer records and the electronic medical records, to show that I think it was 8 of the babies had a lot of face-to-face time with the index patients based on medical records, changed their diaper, fed the baby type of thing. So those were screened as lots of face time is a higher opportunity for infection. And then the other 7, we found that the infected worker spent a lot of time with mom based on those same medical records. And a lot of times the baby is at mom's bedside. So even though maybe not changing diapers, not feeding the baby, they're in the same room as the baby. So when they ran those numbers, they found these 15 that had more than usual exposure to the infected patient. So of the 15, 8 were already on the list, so we kind of lucked out on those, and those 7 that weren't on the list, we're adding them to the list.
And that leads me to the next question. From the beginning, you've been using potentially exposed, possibly exposed, maybe exposed and exposed. And I understand that exposure is exposure, but what is the criteria there to use potentially exposed or exposed?
They're kind of interchangeable, to tell you the truth. There's degrees of exposure. I think we talked about last time. If I had TB and I'm going on a cross-country trip in the car, that's a lot of exposure. If I just walk by, if I'm infected and I walk by you on the sidewalk, that would be a minimal exposure. So there's a lot of variables that come into play. If we spend, go out for a couple of beers, go to dinner together, and maybe you're on chemotherapy, maybe you have HIV, even though my level of infectivity is the same, your ability to fight that disease is lessened. And our babies are in that place. They have a lesser immune system, less strength, so we take a greater level of precaution with them.
And you said that 18 babies are being treated at home twice a week. Do you think this is a sign a majority of the parents are declining that treatment? Because it's just only 18?
Nick, do you know that?
I do not have that data.
It would seem so at this time, but we've had some parents initially say, let me think about it, let me talk to my pediatrician, let me go on Google and research it, and often they will come back and say, okay, we've had a change of heart.
What is the name of the medication that is being given to these babies, the preventive medication? Could you spell it out? And are those 3 positives that are not related to this BCG vaccine all latent?
Well, the medication that we offer as window prophylaxis is called isoniazid, ISO, NI, ZI, D, and they put 3 letters called INH as a short for the medication.
And the 3 positive babies that are not related to the BCG vaccine, are they all latent?
Well, we consider to be infected, since the chest x-ray is still negative, we're not considered that latent yet, but infected. So that's why we're offering that window prophylaxis to those babies. And we also need to do some more investigation around their house too.
I'm sorry, infected with active TB or latent TB? What? Really confusing.
It's confusing with all these terms. The latent TB, you have the bacteria dormant in the body. When you have the infected, you were exposed to the bacteria, you might not be dormant yet in the body.
So these 3 babies tested positive. Could you characterize it again? What kind of TB do they have?
Just exposed or infected. I guess we could characterize as infected.
Because of the exposure?
Yes, but they've been
Because
exposed,
of the-
subsequently infected, and so far, thank goodness, not sick. I don't want to put words in your
Yes.
mouth, we
No,
okay?
perdón, me dice eso en español. O sea, según las estadísticas que tiene aquí, son un total de 8 positivos. 5 de ellos que fueron vacunados. ¿Cuántos
Sí.
niños son?
Han salido 8 positivos. De esos 8, 5 les dieron la vacuna de la BCG, que puede dar un falso positivo en la prueba de la tuberculosis que aplicamos aquí. Entonces, de esos 3 que no tienen la vacuna de la tuberculosis, estamos enfocados en eso para hacer también un poquito más de investigación alrededor de esos niños.
Entonces, ¿cuántos infectados hay?
Son técnicamente 3. Los otros consideramos que son falsos positivos por haber recibido la vacuna.
¿Estos 3 casos son de aquí del Paso o de otro lugar?
3 positives, El Paso?
The 3 positives?
Yes.
From El Paso.
Thank you.
And the other 5, I believe, they're from Mexico, right?
Most probably.
Or they visited.
Or the-
Because of the vaccine.
Because of the vaccine.
Okay.
And how much has this cost the city so far? Have they billed Providence, or if so, how much? And if not, why is that?
We haven't, so we've got several organizations that are helping with this. The feds, the CDC, they'll pick up their own tab. The State Department of Health Services, they'll be picking up their own tab. We put in accounting measures for timekeeping and such. We haven't had one full pay period of this yet. We had a half a pay period, we're not done yet. I think the early estimates for our September efforts is around 70,000.
Is there any way you can prove those 3 cases were infected because of the nurse?
No, and that's why we look at their family members, their household, and every time there's a positive, we're working on testing the family as well and see if they may have gotten it somewhere else. I mean, there's an assumption that's made, they were in the hospital, they were exposed, that's where they got it. It's not necessarily, and we may never know, which is a frustrating part of epidemiology.
And do you have an exact number of how many parents have accepted the treatment?
18.
Is that?
It would be the same.
Okay.
Yeah, those who choose not to have the treatment, we do have them sign a waiver of such.
Is the city keeping track of that, or is Providence keeping track of
We are.
that?
And 18 out of how many patients?
Give me a minute, let me see if I can.
Hold that while he looks it up. We can continue. The other thing, before I forget, is we're not going to do the one-on-ones. You guys all know that. I'm sorry. I also brought some samples. None of them have the bacteria in it. I know some people thought it'd be cool, so I got pictures. This is a safe press conference of some of the laboratory equipment that we use to test the bacteria, and some pictures of how we do that. So if you have any questions, just to explain the complexity of TB, most diseases, it's one test and you're done. TB has so many different ways of doing it, and some of them take 6 to 9 weeks to get your results, which can impede an investigation. So we try to jump the gun, make some assumptions, and then let the lab work catch up to us. Yes, sir.
Last press conference, I remember you said that only something of co-workers had been screened, and that there were just 2 that had not been screened because they were away. If you could give us an update on that, and also if you could tell us about the social and personal relations of index patients.
Okay, since it's ongoing, we're not finished yet. Lana, do you have that?
Okay, so none of the coworkers have tested positive, right?
No. There was a night shift discrepancy where some co-workers, if you will, who never spent time with the infected worker, had a changeover, if you will. They test positive. Doesn't mean they're infectious. Like many in this room, we test positive, but we're not infectious. So there was a night staffer that changed over, may or may not, probably not exposed because they never worked together. It could have just been a random changeover.
And she tested positive, and she was not latent before. She was not
Correct.
latent.
We call that a conversion.
What about family members of that worker?
So far, all negative.
So
But I gotta tell you, it's early. We do that 6-month thing again. Early on, we check, and we'll wait 6 months, and we'll check again, because it's a very slow-growing bacteria.
And that night shift worker could have gotten TB somewhere else.
Absolutely.
And if the baby tests positive, you test the family, but how extended is that testing? Is it parents, siblings, grandparents, or how far is that?
That's a great question. This is where real epidemiology takes place. Baby epidemiology is so much different for TB. So what we started was with household members. And we test all the household members. If they're negative, we're done. If they're positive, then we'll expand out to the nursery, the church, wherever they hang out, to friends and neighbors, if there's been that kind of contact. If they're all negative, we're done there. If they're positive, then the circles continue to grow.
The nurse will be able to work them?
It wasn't a nurse, it was a
The
health, like a CNA, healthcare assistant, I forget the exact title. Yeah, once not infectious and treated, like many others in the healthcare industry, you go back to work safely.
And actually, one thing that I want to add up to your question, the babies don't transmit TB to the adults. The adults are the ones that can transmit TB to everybody else in the household. So another point that we take in consideration as far as doing the TB investigation is the amount of time that they spend with anybody that is an adult that has an active case of TB.
Yes.
So if we find a baby, we need to look for one adult in their household.
So when we're checking the household, back to your question, that's a great difference. We're not looking to see who the baby infected that, but maybe a household member infected the baby. So it's more of a clinical investigation to rule out, rule in the hospital as we do our exclusions. Yes, sir.
Also, I understand that the index patient, she stopped working on August 15th, and then she, according to the CMS report, she was tested, or she tested positive at her doctor's office on the 21st. But then you sent out, you gave out information that she tested positive on the 27th at the El Paso Health Department. Several questions on that. Why is there 2 days? Did she test positive at her doctor's office and was retested here? And also, I understand that she was placed on leave. Was she placed on leave on the 15th when she couldn't work anymore, or was she put on leave after she informed the hospital?
I wish I had a calendar with me. She walked into our offices, and I wish I had the date. If anybody can help me, I would appreciate that. And based on her symptomology, we excluded her from work. Was it 15th?
The 25th, and then she tested, the test results came back the 27th.
Okay, thanks for your help. I'm sorry I don't have all the data in front of me. You guys stump me all the time.
And as for...
So we will sometimes exclude someone from work just based on their symptoms. I mean, we've got all this testing stuff, but like I say, that takes weeks. So if someone's coughing up blood, that's usually a good signal. They have other of the symptoms, the fevers, the night sweats. We can exclude them from work and let the lab work catch up.
So,
And as to the doctor, I don't want to leave that hanging. The law in Texas is, if you're, it even includes parents. If you're a physician, a nurse, a parent, and you even suspect someone has a communicable disease, you're under obligation to report that to the health department. That doesn't always happen. Sometimes we get 2 or 3 reports, which is great. I'd rather have 2 or 3 than 0, but sometimes we get 0. So we've been working with the local medical community, reminding them that you don't wait till it's a positive. Even if it's a suspect, get them into the health department and we'll start our investigation.
So just so we're 100% clear, the timeline is, according to CMS, she tested positive on she stopped working on the 15th. She tested positive at her doctor's office on the 21st. That's according to the CMS report. And then you say she came in on the 25th and she tested positive here.
She didn't test positive, it was just on symptoms.
Okay.
So in actuality, this person, and I don't want to talk too much about this person, a person who comes forward and is positive, they actually test positive several times if they're truly positive. As you look at this, there's a positive right there in an X-ray. There's a positive right there in a lab. DNA positive, smear, looking under the microscopes positive. So there's many, many ways that someone can test positive. So you can actually have several test positive dates depending on what tests you're doing. So this particular person has had several positive test dates.
Okay, but on the 27th, you say that this person was diagnosed and tested
On symptoms only.
on symptoms only. And then the health department, El Paso Department of Public Health, said that she could not work anymore. You put her on leave.
Correct, and we notified the hospital as well.
Okay,
And then the hospital did what they're supposed to. Oh, thank you. The timeline. These were handed out last press conference. If you didn't get them, we can get them to you today. Would that be possible to print out another set of our timeline? and as many, and it's updated too, because there's been more stuff happen since we've had our last press conference. I'm sorry.
And you said the hospital did what they're supposed to do, which is?
Well, it almost seems kind of silly. We notify the hospital that we're keeping her from work because we suspect she has TB, and they in turn call us right back and say, we're reporting to you that one of our employees has been diagnosed with TB. So they followed the law to the T in notifying us after we notified them.
But it was you that said she cannot work anymore.
It was both, but we said it first. I mean, within an hour, if that's what you're looking for. But we worked collaboratively.
No, I'm just trying to understand the timeline.
Can you clarify the number of babies possibly exposed in Mexico? Because I believe you guys said it was something along the lines of 27, but Juarez Health Department said it was 86, I believe.
Okay. Can I tell you definitively? No. What we did, where that 26 number comes from, is when people check into the hospital, they provide an address. And that 26, when we get our list of the 580 some, 26 patients listed Mexico as their primary address. Several people apparently used post office boxes or second homes or families' homes in El Paso as a mailing address where they actually we're living in Mexico, and that's where the disparity is. So every time Mexico goes up by one, El Paso number goes down by one as people are shifting. Our key is not so much where they live, but to make sure those babies get found and get tested. And some military families, they move all the time. We've been tracking them, and there's going to reach a point that if they're tested and they're still moving on, we don't need to track them anymore.
Also, it's 8 people, about, 1% of a bit higher than 1% of the people that have completed a screening. Are you?
Oh, it's much higher than that. Much higher.
8 people, and you have completed 615, that's what, 1.5%?
8 people tested positive. Okay, 5 of those are probably false positives. So 3 people out of everybody we've tested, I forget what that number is, as of this morning, that was 0.48 or 9%. It was less than 0.5%.
And that's lower than statistical.
We had anticipated 1%. Based on other similar outbreaks, you kind of use that as a guide, as a benchmark, if you will. So we're half of what other similar situations have seen in terms of the infections.
Going back to the index patient, because we are getting these kinds of calls. This is a person who's coughing up blood, had fever and so forth. This person also circulates in the community, eats at restaurants, cafeterias, whatever. Do you know whether the investigation on this person's contact circle has expanded?
It's ongoing. There's some people that we haven't been able to contact yet, but of all the contacts we have made so far, everyone's tested negative. Thank goodness.
Can you clarify the active and latent TB for Ms. Washington? I think that was still kind of pending. None of these cases have been active.
Active TB is you have an infectious process that makes you sick going on, a meningitis, a pulmonary infection. But many of us have the latent TB where you're healthy, you're walking around and you don't know it, most people don't know it, and there's no symptoms. How about that? There's no symptoms of disease, and yet you're infected.
So you say 8% have not been contacted yet. Can you kind of describe the people who you haven't been able to reach, out of the city, out of the country, who are the...
It's a mix. It's help me out, I would guess it's proportional to the 92% we have found.
So we have 65 people that we're still trying to contact. 11 of those are outside of the county. That's the best I can do for you.
And every day these numbers change, so if we're not current and it seems like we don't know where we are, it's because we can't keep up with the amount of change that does go on. We're trying our best. Thank you, Nick.
So what will be done when you're learning all this, you're having more patients or not? What's going to be done? What's the protocol now?
Well, it starts with a spike. We announced 800 babies exposed, and boom, the phones are ringing off the wall, and that has died down. And then every once in a while we have a spurt of an extra 90 patients, it goes up, and it continues to go down. Eventually, as time passes, the older babies, they come in, they have their test, they're negative, their chest x-ray is clear, we're done. So we've had some of those already. The younger babies, they'll come in, have their first test, be treated if the parents agree to it. They come back for their second test, it's negative, we're done. So the majority, these 92% or so, we'll be finished with them here pretty shortly. Then there'll be that 8% that's still straggling, for lack of a better word, that we will hopefully pick up over the next several weeks. And then we kind of start again with the babies who at 6 months old need to be tested again. Those are the 199 that we'll be testing over the next several months. And there's also the treatment component of it. So those babies who are being treated, while they're getting treated, we'll be sending staff, nurses to their home twice a week to make sure that they're handling the medication okay, they're taking the medication properly, checking in with the parents, answering any questions they have. So this will go on for several more months, but not as intensely as it has been here in the beginning.
So I know you talked a little bit about kind of modeling, the numbers off of other outbreaks. So in terms of, have you guys been in contact with maybe other cities, other hospitals that had maybe had an outbreak like this, or can you talk more about?
We have not. We just use the CDC because whenever there's one of these, the CDC is always present. So if we talk to the CDC, we can get it all in one source instead of talking to half a dozen others.
And I think you already answered it, but hey.
But you're going to ask anyway.
Yeah. Just to be sure. I mean, like, since you're not doing one-on-ones.
I got you. Okay, you're going to get punished.
Last press conference, you mentioned a subset of babies that you were more concerned with immunocompromised and other babies. If you could tell us more about how they're doing and what you observed there.
The biggest group are those that were under 6 months because they have the very infantile, if you will, immune system. What we did when we scheduled patients is we'd have to ask how old the baby is. If the baby was 10 months old, we'd put them towards the end of the line. If the baby was 1 month old, we'd put them to the front of the line. That sounds horrible, but scientifically, we really needed to concentrate medically on those babies that were at greater risk. And we stratified 2 tiers of where the babies would fall in. So those were the babies that were the immunocompromised. We looked also at moms that had HIV, babies that had HIV, and we came up 0 on all of them. Moms with cancer, babies with cancer, we came up on 0 on that list. Those were the types of immunocompromised that we would be looking for.
But you mentioned that like 15 babies that the CDC told you that you had to watch out for.
Yeah, they weren't at the time we didn't know they were immunocompromised, and they weren't. Those are the ones that we could document had a lot of face-to-face time with the index patients.
Okay.
Documentable, provable, lots of face-to-face time. And of the 8, I believe they've tested negative, which is great.
If either of you were parents of a child that needed a prophylactic treatment, would you have your child treated prophylactically with this medication?
If I had a baby that is less than 6 months, I would, because I wouldn't have to worry that at 6 months, now my baby becomes positive, then I will be very concerned.
Yeah. That's yes for me, too.
Are the hospitals and clinics and doctors going to change their procedures now after all this?
They may not have to. If you have the CDC protocols in place and you're following them, this doesn't happen. Or it's very rare that it would happen. So there's minimum procedures that should be followed. For example, here at the health department, we've been asked this from time to time. We have very little long-term contact with our patients that come in and out, but our TB workers, that's a different story. They can spend months with somebody. So our TB workers, we test them every 6 months. The protocol, for a hospital where you have a lot of a lot of turnover, the protocol nationwide is the annual testing, unless of course there's symptoms. If there's symptoms, you speed that up and you check up on it. So for our staff who work with TB-infected, active patients every day, we test them every 6 months, and at least since I've been here, we've had no conversions. So although TB is communicable, it's generally not easily communicable.
Since we're on timelines, I'm talking about timelines, but I'm talking about timelines.
How do you feel about the way the hospital handled this, how fast they reacted to it? I know they dropped the ball on the annual screening, this person reported cough and blood, and then they let 6 weeks pass. But then on the 21st, they should reported that to the hospital, and then they didn't report it to you on the 25th. Is that normal in terms of reporting?
None of this is normal, I'll tell you. This is a once-in-a-lifetime type of deal, so it's new to all of us. But the day after we found out, we were at the hospital meeting with them, and they were eager for our help. And as it developed, and we've asked them for lists, even I think today I asked them for 3 more lists, so we can just double check, triple check, and they've delivered already? Yeah, so I asked them at 8 o'clock this morning, it's now 11, and they've produced those lists. So we're doing as much double checking, triple checking to make sure no exposed baby, gets missed. It's really important to us. And at the end of the day, when this is all done and we're 0.1% positive, am I going to feel sorry for that? No. If this ends up and no baby gets sick, we've aced this. It worked out for the best. It was an unfortunate situation. No baby gets sick. It's a good outcome. Is there a cost? Yeah, but what's too much to save a baby?
And just to verify, you said 860 babies need to be tested, and that increased by 7. I just want to double check that.
There was 853 babies. We added 7 today, yesterday. So we're at 860 babies that we're recommending be tested. And part of our problem, and I think we've mentioned this, is for whatever reason, some patients aren't coming to the health department. They choose to go to their own doctor, their own pediatrician. So we strongly suspect that there's been a lot more babies tested than we know about. We're reaching out to these doctors. I think we faxed 600 doctors yesterday saying, hey, if you've got some of these babies, you need to fill out the forms and get them back to the health department. So it looks like we may be lagging in the screening of these babies, but if they're being done in other states, in other doctors' offices, it takes a while before we get those numbers. And I really expect those to increase substantially. No one-on-one, so last shot.
For the record, your first and last name.
Robert Resendiz, R-E-S-E-N-D-E-S.